Cash, Form A. First aid to restore breathing and repulse of an unconscious adult. Conditions. You see an adult collapse in front of you on a fob, not in a stable environment, no spinal injury suspected, and you have a BLS bag, CLS bag. This is the bag I'm talking about. There's one here, here, by that Randy, and the other Randy. My 3 pieces of equipment are the bag itself and 2 MPAs. One is adequately sized, and the other one is the one you're going to use. Yes? So you get a small one and a not so small one. Okay? Use the not so small one. Standard. Correct perform all tasks 2 standard in sequence 1 through 12 within 7 minutes. You have 7 minutes to crush this station. Yes? If you take any more time, you're gone. See ya. You go into the house. Without causing further injury to the patient. That's why I asked you to tell me when you come test, hey, can I remove X, Y, and Z? Yes? Free chicken. It's for you, not for me. I already earned mine. Wow, I sound like a pretentious asshole. Alright, so first thing you're gonna do is AVPU. Anyone know what AVPU is? What is it?
Alert, burning, pain.
Alright, you're gonna do a very quick, abbreviated version of AVPU by
Are you
doing
okay?
this. You
Hey,
say, are you okay? Smacking on the stomach or face, whatever, stern rub, something. He's then going to do 2 things after that because he's
You
unresponsive.
get an AED, you get a medic.
All right. You identify 2 people, one to get an AED, the other one to get a medic. When that happened, he's then going to roll the Kowski on his or her back. Give side to Kowski, raise the arm, sick, arm has already been raised. Place the arm down, fix the feet so that they are generally straight. I understand it's a Randy. If he has hip dysplasia, don't worry about it. It's his problem, not yours. Once he is complete, meaning arms are down at their sides and feet are by each other in a straight line, roughly, I'm going to state the casualty does appear to not be breathing. That is going to make him go into step 3, opening the airway utilizing the head tilt chin lift method. Note where his fingers and hands are. Right now it's his right hand, which 4 fingers or his palm is going to be on the forehead, and you have the index finger and middle finger underneath the chin. He is going to be looking, listening, and feeling for some stuff. He's going to say the stuff.
So I'm observing the right ball in the chest for 15 seconds.
Yep. He is also going to be looking and listening, as you were listening and feeling for breath on the side of his face and respirations for the same amount of time. He's going to say that the first iteration. I'm looking for the rise fall of the chest. I'm feeling your breath on the side of my face, and I'm listening for respirations for 15 seconds. Because then every other time you have to do that, say, I'm looking, listening, and feeling, so you can carry on. Yes? All right. So after he's done that, he's checked breathing. I'm going to state the casualty is not breathing. He's going to step 5, inserting the MPA. So he's going to first measure said MPA. He's going to make sure he has the right one, not the adequate one. You're going to measure it from the nose to the earlobe, the nose to the jaw. He has identified the correct one. He's then going to cut it if need be. He's not going to need to cut it. He's going to lubricate it with the patient's saliva or a water-based fucking lubrication, whatever he has. Saliva from the patient. You're then going to pig nose the individual. You're going to have the bevel towards the septum. The bevel on the MPA is the open end, the one that's angled, yes? The angled portion towards the septum, meaning that little piece of skin between your 2 nose holes. All right, sick. Once he has done that, he inserts it. Once he inserts it, you can put it off to the side because I don't have tape to secure it. This is the only one that has a hole in the nose. Don't worry about it. Just put it in the bag. You're fine. All right. After he has done that, he's going to recheck breathing as per 5 golf. Looking, listening, and feeling for 15 seconds. He's going to state, what does feel 15 seconds.
What does it feel for 15 seconds?
All right, sick. Cassidy is still not breathing. That's why I'm going to say he's going to be prompted with that to go into getting breaths. 2 breaths. 1, or you're gonna pinch the nose, give a breath, look, loose, and feel for a second. Pinch the nose, give a breath, let go, look, loose, and feel for a second. Yes? All right, sick. After he's done 2 breaths, which is 1 round of breaths, I'm going to state that his chest is not rising or falling. He's going to now more aggressively or assertively do a better head tilt chin lift and redo breaths.
So you're not gonna be able to actually move their heads. You're just gonna verbally say that you're more aggressively pushing back their head.
Yes. These necks will break. They already broke theirs earlier today. So, all right. He's doing his head tilt chin lift more assertively and giving 2 breaths. Pinch, breathe, unpinch, look. Twice. That is 1 round. All right. After he does the second round, I'm going to state the chest did not rise. He's going to do step 7, which is essentially CPR. He's going to give, as you were, you can find the fucking nipple line, place his heel of his hand on the sternum of the patient. You can place the other heel on top of the other hand. Fingers are interlaced on top of each other or to the side. Elbows locked out, shoulders not sagging, and he's going to conduct 30 repetitions of chest compressions, roughly 1.5 to 2 inches in the chest,
30.
at the rate of 100 per minute. Those of you who know The Office, the freaking song from the Bee Gees, Staying Alive, that is roughly how fast you should be doing it. If you do 1, 2, 3, 4, you're done. If you go too fast or too slow, you're done. All right? So,
1, 2, 3, 4, 5, 30.
whenever he does 30 compressions, you are going to conduct 2 breaths, the same way you did earlier.
You're gonna visually inspect the casualty's mouth.
Yes, like you said, you're going to visually inspect the casualty's mouth, because I'm going to state you identify something in his mouth. Using the correct procedure, he's going to remove it. The procedure is the hook method. He's going to hook that shit out. After he's hooked it out, he's then going to give 2 breaths to make sure that is the only thing in his mouth. After he's done the 2 breaths, I'm going to state that his chest rises and falls. That's his prompt to then check pulse. Note where his hand is for step 9. Check pulse for 5 to 10 seconds. He's going to say, I'm checking for pulse 5 to 10 seconds.
Check the pulse for 5 to 10 seconds.
So, he is on his side of the Adam's or of the neck. For the Adam's apple on your side, index and middle finger, gloves removed, like he is right now. Yes? All right. Once it's done, I'm going to state you do not feel a pulse. You're going to repeat step 7. Step 10 and 7 are the same. 30 repetitions, 100 beats per minute, and 2 breaths.
1, 2, 3, 4, 30.
So, as soon as 1 correctly performed set is done, so the 30 and 2, I'm going to state 2 minutes have elapsed. After I state 2 minutes have elapsed, he is then going to go directly into checking 2 things.
Checking the
2
pulse
minutes,
for 5 seconds.
you owe me 2 things. Like he said, he's checking for pulse now for 3 to 5 seconds instead of 5 to 10. Yes? All right. You do feel a pulse. He's now going to check for breathing for the same time, 3 to 5 seconds.
Check
That's
for breathing for 5 seconds.
2 things for 2 minutes. He is then going to be told you do not hear or see him breathe. He's not breathing on his own. That is going to prompt him to
4, 5.
give breaths.
1, 2, 3, 4, 5.
He's going to give a set of breaths. A set is still 2 breaths, yes? He's going to give 1 breath. He's going to count to 5 like he just did twice. Breath, count to 5, look into the chest. Once he has done that once, I'm going to state 2 minutes have elapsed. So again, 2 minutes, you owe me 2 things. Those 2 things are these.
Checking pulse for 5 seconds.
Yep, he has a pulse.
Checking breathing.
He is breathing and conscious. After I state he is breathing and conscious at the end of step 10, golf, he is then going to go to step 11, which is the recovered position. Secure the nearest arm to you. You can help yourself out by positioning his leg like he is right now with a slight bend. securing the head and neck like you did in step 2, and then however you can make him roll over, roll over. These nerds, the weight is all in the chest, and they're roughly 200 to 250 pounds. Yes? So you have to give it some gusto. And then you're gonna secure his arm so that it is underneath, roughly, like here, his chin. So if he leans forward, his elbow is gonna stop him. Also, his knee should stop him. This is the recovery position, yes? After he's in the recovery position, he's gonna do state 4 things in step 12. He's gonna say,
If the casualty's condition deteriorates, I'll continue to perform CPR until breathing and pulse return,
1,
relieved by a medical professional,
2,
or I can no longer perform CPR.
3, and this time use the go. That's it.